So there's a new rule with health insurers that deals with something we've had so many complaints about in our Team Clark Consumer Action Center, where you get free one-on-one advice. And it's about when you can't have something done that you apparently need to have done because the insurer is slow-walking approval in plans that require prior approval or denies it without any clear explanation. I want to tell you, there's some help and hope on this front because the cynicism and the internal whistleblowers who have leaked that a lot of insurers deny without even reviewing, just hoping you'll go away. One of the biggest offenses of the health insurance industry is trying to avoid spending money by having in their plans that you have to have prior authorization for various things, and then stalling or denying without really reviewing to try to get you to go away or just pay out of pocket. Or in the most cynical way of looking at it, if it's something really expensive, hoping you die waiting for approval. And this has been something that has been a frustration for doctors for years, that insurers, they have to waste a lot of time with their staff trying to get things approved and all that. And it's just a dirty, cynical game that the health insurance industry does. Well, now a new rule reduces for not all the population, but many of us in the United States, reduces the review period for something serious like with my heart operation to 72 hours for something major, otherwise a week. And the insurers now have to be very clear on what the reasons are they denied approval, is a weird way to say something, for something that you want. It is one of the dirtiest things that the health insurance industry does. And so know that under many health insurance plans, you are covered by this new rule. Who's not covered by it? If you work for a giant company that self-insures its plans, you are not yet covered by this. But this is true now for people in all those Medicare Disadvantage plans, which have been at the forefront because they're dealing with an older market that often will have people who have very serious health problems. And so they stall, or deny without any clear explanation of denial. And again, maybe they never actually reviewed it, they just deny it. And so now you are covered by this new rule. You work for a smaller company, you're covered by this new rule. If you buy your own health insurance on the healthcare.gov, affordable care plan thingy, you buy one of those, you're covered. The biggest hole in this is the big company workers working for a company that all they use the health insurance for is to process claims that are paid by the employer. And the insurers take the lead of the company you work for. Hey, our expenses are too high. Let's see what we can do to do some cross control. And a lot of administrators doing these plans think the best way to do this is to delay, deny. So Congress would have to pass a statute requiring those plans as well to have expedited, clear processes for you to be able to get approval, for doctors to be able to get approval, so that somebody doesn't die waiting for that approval to happen. So I'd say this is a great step forward. It's not where we need to be yet, but definitely a great step forward.